Good morning and welcome. We're here with U.S. Senator Tim Kaine, who has been a senator from Virginia since 2013 and also the 70th governor of Virginia. Senator Kaine was also Senator Hillary Clinton's running mate for president in 2016. So we're so happy to have him here with us this morning.
Angela, great to be with you, and I'm happy to be with you. I'm actually tomorrow, May 3rd, I celebrate 30 years since my first city council election. So as you talk about the titles, remember I started in local government, but it's hard to believe that 30 years has gone by just like that.
Right. So today, yeah, it has been a storied career as well. And today we're here to talk about shortages in medical health care. And you are introducing a couple of bills or have introduced these bills and continue to work to get them passed. Can you tell us a little bit about them?
Angela, absolutely. And it's a good day to talk because, as you know, the Health, Education, Labor, Pension Committee just had a hearing. I'm on that committee, and it was a hearing about the need to recruit more minorities into health professions. And it was also a hearing about maternal mortality, which is unacceptable in the U.S. compared to other nations. But it's also unacceptable that there's such significant disparities between white moms, African American moms, Latino moms, tribal moms. But on the workforce issue, we were short in our healthcare workforce before COVID, and then the pressures of COVID exacerbated these shortages. The shortages are particularly high in some urban communities, in rural communities, and then in some specialties like behavioral health, we're really short. And so we need to do some things to promote a healthier and more robust healthcare workforce. So I have a couple of bills that I'm really focused on. One is a bill I'm working on with Senator Padilla and others to accelerate the ability of HBCUs to have med schools. An awful lot of HBCUs train students who go to med schools, but there are not sufficient numbers of HBCU schools that actually have their own med schools. You see Morehouse, you see Howard, but the good news is a number of our HBCUs, including Hampton, including Xavier in New Orleans, which is trained tons of undergrads who've gone on to medical school, but they've never had their own medical school. A number of our HBCUs are starting to explore, if we want to deal with African-American population is about 14%, but the percentage of America's doctors that are African-American might be more like 5 or 6%. There'd be a similar disparity in the percentage of African-American nurses. And so I think our HBCUs are a key part of this challenge, and I'm glad to join with other senators and work together with institutions like Hampton to explore creating med schools on HBCU campuses. The second bill that I just introduced within the last couple of weeks, and I'm very excited about it, is called the Welcome Back Act. And it goes after a particular kind of healthcare professional. There's 270,000 immigrants living in the United States who are here lawfully, either citizens or green card holders, who have been trained to be healthcare providers in the countries where they were from. But because of differences in licensure or credential, they come to the United States and they're not able to practice the profession for which they've trained. And they have to work in retail or be Uber drivers, instead of being healthcare providers. And 270,000 is quite a big number. And I've had the opportunity to interact with many of them. I was at a program recently in Charlottesville that is really focusing upon helping adults attain English fluency so that they can then integrate into the economy. And learning a new language is hard enough, but finding a path to continue the profession that you've practiced your whole life in another country is also a challenge. So these two bills, one by having more HBCUs with the capacity to train physicians, and the other finding a quicker path where immigrants with healthcare training can get into the healthcare workforce, are both things that I think can be really, really helpful to the current shortages we're seeing in the healthcare field.
And you talked about people who have come from other countries who have medical training and then being able to get into the medical profession here. But there there are people here that are actually leaving this country to get medical training, to be trained
Oh,
in other countries. So this would actually help that as well. And why not keep those students here?
exactly. When I was governor, one of the things I was proud to do was we increased um, the size of Eastern Virginia Medical School by a third. We increased the size of the VCU Medical School by a third, and we started up a new medical school, Virginia Tech Carilion, in Roanoke. And that was because we felt like, the needs of a growing Virginia, an aging Virginia, were going to require many more physicians to be trained in state. And if you train your physicians in state, they're more likely to stay in state. If they're trained elsewhere, you can make an effort to get them here, but training in state is one of the best ways to make sure they stay. But we have to do more of that. And then the other thing we have to do is probably from a federal level, fund more residencies. When you finish med school, you hit that a really important day in March of your last year where you hopefully match up with a residency. But we haven't funded residencies enough, and that leads to a tragic situation where students go to med school for 4 years and they usually take on a lot of debt. And then they get to a day in March and they don't match in a residency. A physician without a residency opportunity is going to have dramatically limited professional opportunities. And if we were able to fund more residencies, we wouldn't end up with this mismatch where we have too many med school graduates and not enough residency programs to help them advance on their training.
That is a tragic situation, and I am so happy that you have taken this up. There's also there are corporations that are taking it up as well. Healthcare systems, Sutter Health just announced that they are providing $7.5 million for scholarships for medical students at Charles Drew University, who just
Excellent.
recently had their first class of medical students enter. And also, you mentioned Xavier, and they have also partnered with the healthcare system. Then Morgan State is getting an osteopathic medical school.
Mm-hmm.
So these
That
funds would definitely be beneficial.
they would. And Angela, I think one of the new models is when you see medical schools starting up now, they're really kind of taking a page from this Virginia Tech Carilion partnership, which dates back to 2009. Instead of the medical school just being part of a university, it often has, a partner in a healthcare system. Hampton has a really interesting proposal. Why not start up the medical school in partnership with the VA? That's right there on the campus. We know we need many more physicians who could work with veterans. It's really common for physicians who work in large hospitals to have like part-time appointments at the VA. A lot of the physicians, for example, at VCU Hospital in Richmond also do work over at the McGuire VA in Richmond. But as far as I know, this might be the Hampton proposal, might be the first one where the health system partner is not like a private health system, but the VA. And I think that would be fantastic, particularly if you think about Hampton Roads not only has the VA, but also has a significant Navy hospital in Portsmouth. The DOD plus VA footprint in Hampton Roads is very significant. And I think Hampton could not only train some great physicians, but also be a real source of support to veterans and military healthcare system that needs great physicians and allied health professionals as well.
I've often thought that that would be a great idea to have medical school at Hampton. And the former president, Dr. Harvey, teased me and said, yeah, if I could raise $200 million, he'd put my name on it. So yeah, they're quite expensive. And that was actually for a hospital at Hampton.
Mm-hmm.
And they also have, because I think each bed is like $1 million per bed when you start a hospital. But Hampton also has the Hampton Proton Therapy
Yep.
Institute. So it
Indeed.
really makes sense. Yeah.
It would. When I was governor, President Harvey, who I know well, came and said, is there a way the state can help with this? Of course, Hampton is a private university, United States University, but I worked with my team to authorize Hampton use the Virginia Public Building Authority to issue the bonds to build that facility. That was not the same as a grant, but it was the most reasonable interest rates you could get if you're using public building authority. So, and then at various points along the way, governors since me have also put dollars in. We have done some federal funding into that. But I think that institute, it would make an awful lot of sense as part of a medical school, and in a medical school that was operating in tandem with the VA and the DoD facilities, like the Portsmouth Naval Hospital. Now you're suddenly talking about not a standalone institute, but part of an integrated healthcare network that I think would be great for patients, great for Hampton, and then great for the institutions like the VA and Portsmouth Naval Hospital.
Yeah, we I really appreciate all these creative ways for solving these problems. And we also have to think about technology as well. And I really appreciate you joining us today and all the work that you're doing.
Thank you, Angela. I look forward to seeing you in Hampton Roads.
I'm looking forward to it as well.